Thanks everyone for joining us. Happy to be here. Welcome to my esteemed guests. And I guess why don't we kick it off? Kind of introduce yourselves, your firms, what you do, and how you got to be here.
Sure. Let's see if I did it. It turned on. My name's Nell. I'm the founder and CEO of Folia Health. We are Boston-based digital health company. We've been around for 7 years. Actually, our very first kind of office was just down the street here. An investor was nice enough to let us live out of their office for a couple of months. We work with people who are living with complex conditions. So we define that kind of broadly as the pill pack market, people who are experiencing one or more chronic diseases that are either difficult to diagnose or difficult to treat. Unfortunately, it is actually most chronic conditions except for, like very basic diabetes without any complications. And so I originally got into this because I have a younger brother who has CVID, which is an immune deficiency, and had experienced the difficulty associated with both getting his diagnosis and figuring out the right treatment plan. And it's, iterative over time, but never data driven, right? And at Folia, what we do is we capture information about what people are experiencing in a structured and actionable format. So it's not text, it's responses to questions that are suggested on the basis of what someone's experience has been in the past and how they're like other people on our platform. They collect this information over time and use it for their own care, as well as for research studies that they participate in. So the platform is totally free for individual users, and then these home-reported outcomes that they're capturing are used with our sponsors that are pharma, biotech, and academic researchers to collect information about both the burden of disease and the impact of therapy in these populations. And so it's kind of we think of it as a single source of truth for the individual. People can keep using the platform whether or not they're in a research study. You could download it right now and use it for yourself or a family member. And then they are also able to participate in studies in the exact same platform and have the continuous access to that data that they're sending for research as well. So it really is kind of joining these worlds of research data and individual tracking data to be able to enable better care, but also more patient-driven research.
And hi, I'm Heather Campbell. Ready, Set, Recover helps people get ready for and recover from surgery in a better way by looking at the human side of surgery. We're complementing what is happening on the medical side. Similar to Nell's story, it started because I needed it. I went in to talk to a surgeon about finger pain in 2 fingers, and he said, I have good news and great news. Good news is you've hurt your fingers, they'll be fine. But the great news is you have something really wrong with another finger, and normally it would be bad. But because you're here, I can fix it with surgery. And I thought, great, that's wonderful. And I walked out feeling pretty good, and then I got home and I was feeling a little nervous, and then I got more nervous and more nervous. And I believe in finding structure, just like you were talking about data. I believe in finding support. So I went and did what everyone would do. I Googled, where can you get support for surgery prep? And I found lots of things on PT, and I found lots of things on other stuff, went down many rabbit holes, but I could not find anything to support me in this moment. And so I thought, okay, what are things from other wellness programs that I could use? And I pulled that. And then I thought, what's going to be specific to this moment? And I used that. And I went and had surgery. And months later, I'm in my surgeon's office, and he's admiring his work. He's very proud of himself. And he said, I really wish all of my patients could be like you. And I said, okay, I'm going to go make that happen. So I've basically taken the gold standards of stress reduction and pulled them together in a framework, worked with medical professionals, made sure that what we were doing is definitely not harming, absolutely helping. And we bring together a structure and framework of what people can be doing to take control during this time when it feels like nothing is in their control. We work with patients, they come to us directly. We work with doctors' offices. My goal, my absolute nirvana would be that if you unfortunately are talking to a surgeon and they say you have to have surgery, that the next words would be, and there's a wonderful program that can help you get ready. We are not at that goal yet. We are in many offices, but not enough. Because also thinking about what the benefit is of this program, while we are benefiting the patient, who we call the participant, We're also benefiting their loved ones, their employer, their doctor, the hospital, and the insurance company. All of those entities benefit when you've got a more purposeful, engaged, and positive patient.
Excellent, great, thank you. And it's both of your platforms and your businesses seem to be about improving patient outcomes. And is that in kind of how the healthcare industry delivers services now? I mean, is that a challenge kind of endemic to the industry right now, or systemic even in the industry? And how is technology kind of able to play a role in improving patient outcomes beyond just the delivery of care?
From our perspective, we have this problem of not actually having the right information to figure out what we need to do for each individual patient, right? So we collect a lot of data, and there's a lot of conversation about aggregating the existing data and analyzing it better, throwing more advanced techniques at it, AI, et cetera, et cetera. There's a reason why IBM Watson didn't go anywhere in healthcare, right? And the reason that our hypothesis and kind of the bedrock of our company is that we don't believe that the right data actually exists yet, right? We're using data that has not primarily been developed for the purpose of patient care. It's been primarily developed for the purpose of either, obviously claims data is essentially exhaust from the payment for healthcare, and clinical data, EMR data, is increasingly actually billing data, right? It's really about payment, but also it's about the experience within the site of care, the point of care, not about everything that happens outside of that. We started out in cystic fibrosis 7 years ago, and even at that time, that was pre-Trikafta, the average person with CF, very life-shortening illness, very severe disease, only saw their clinician on average 4 days a year. Right. So even if that clinical data is very high quality, and in CF there's a registry dating back to the late 70s with very high quality information. Even in that situation, they became our first customers because the CF Foundation and Vertex, because they did not have enough information to be able to understand how individuals were experiencing their disease and how the introduction of therapy would impact that disease progression on an individual level, right? Because ultimately, even in CF, and this is a good example because people think they understand CF, right? There are a lot of diseases where we don't understand anything at all. We know that, like autoimmune disease and rare disease, where we do a lot of work. But even in a disease like CF that can be genotyped, and theoretically we have an understanding of what the course of the disease is, there is so much individual heterogeneity in how people experience both the disease itself and the response to therapy, that we have to have a much more individual granular level data set. And so that's what we do, is we collect that data directly from the source, right? Individual people collecting information on what they're experiencing. And then obviously the next question is how you analyze that. And that's a longer conversation, but that is the type of information we think is necessary to get to this place where we can actually have better outcomes for individuals. We don't think that it can happen by aggregating a lot of EMR data and trying to do advanced analysis on it. It's just not enough information. And we've seen that with my brother. It's actually interesting to watch kind of the way that his care has changed since he started using, he's our first user. So he now has, 6 years of Folia data. And it's just much more data driven, right? He's able to go into the clinic and say, this is what's been going on. Here is my sinus infection progression when I, wait 2 weeks in between infusions versus 1 week. It's a very, personal experience at the clinic, as opposed to, when was your last sinus infection? No, I'm not entirely sure. And, we've all been there.
But I was going to say anything from your end.
Well, it's funny, you're talking about the individual, and then we're also thinking about holistic. Like there's granular, and then there's big picture. When I think about, again, what we're doing with our patients, with our participants, I'm willing to say, okay, surgeon, I've come in, or Amy, so I've got something wrong with my finger. And Amy says, okay. And then I said, it's really bad. Okay. Amy's not going to say, let me cut that open and put the crushed up bones of cadaver in there. That's really weird that that's going to happen. So I'm willing to say that the surgeon, that the medical team has to be laser focused on that. But back to the holistic, larger picture, the rest of us need to be focused on the entirety, all of the things that are, when we're talking about the data, it's so interesting thinking about on that individual level, what are all of the elements that are affecting it? We need to be looking at that holistic picture of all of the elements. And back to that patient experience, we're not. And I'm, again, willing to say, I get it, because it's really weird to say, I'm going to cut open your finger. I mean, I don't know many people here are going to say they're going to do that. So I'm willing to say, okay, you go be laser focused. But the rest of us need to be saying, there's a bigger conversation that has to be happening. And I'm so excited that things like this are going on so people can be talking about what is that bigger picture.
What I find interesting about both your perspectives is you're giving patients more control in their sort of healthcare journey, and in a way that I don't think technology, we haven't been able to do in the past. And I'm wondering, what's your opinion in how consumer technology is driving that? I mean, everyone's got, Apple Health app and stuff like that. Is there more demand among consumers to be able to take this proactive control? And is that been kind of a catalyst for what you guys are doing?
Absolutely. Absolutely. Just thinking about what's the normal? What would you consider interaction? What we consider interaction today, personal interaction, specific, wonderful interaction, wouldn't have even been appropriate 4 years ago. 4 years ago, most of the things that we are doing would have been like, no, that's not real. That's not really going to be helping me. I think about, we were talking last night, and you're going to hear from Chris later about VR. We're using technology now to harness the power of our brains. That's completely different than what was happening before. That's what's happening with Ready, Set, Recover. We're using that technology to harness the power that's actually inside, and we weren't doing it before.
How much you doing?
Yeah, I think that at this point, it's very difficult to separate what someone expects from their healthcare journey from just the use of technology. I think that, increasingly, we do some work with AARP, and like when even AARP, you talk about, the population that they're serving, you think that, well, people who are, AARP members may not be as interested in using technology. Actually, everyone is, right? Everyone that is, currently able to access a phone, which is something like 95% of Americans, expects there to be some level of decreased friction, increased ease with every part of their lives, including their healthcare experience. I think the difference in healthcare is that we have, I think, maybe artificially fragmented that experience. And so it's really hard for individuals to figure out where to go, as you were describing, to get really high quality information, but also tools that they can use. I do think it's important you bring up control. I think it's important to recognize that individual people, especially those living with complex diseases or caregivers of people who are living with these diseases, already are doing a lot of work, right? Everything that you're describing. It's just that they don't actually have simple tools to make that easier. They have to go figure it out themselves. So it's not that we're giving patients something that they haven't figured out on their own. It's that we aren't really enabling, we're not making it simpler. Everybody's having their own difficult journey. When we ask people who come onto our platform what they were doing before, 80% of them were tracking their health previously. They just weren't using a single source of truth platform that makes it easy to collect it and also share it to researchers. They were building their own Excel spreadsheets. They were using the Notes app on their phone. They have notebooks. I heard a terrible story from a patient who'd been living with the disease for 60 years, who lost his notebook on a train in Europe, and was like, there's 20 years of health experience in that. So it's not something that people need to be taught how to do. I think that we're very paternalistic when we talk, even now, right, when we talk about patients needing us to, give them, and what do we mean by us and them, right? I mean, everybody in this room is a patient, whether or not you've lived with a complex disease or not. So I think it's bringing it back to the level of what makes sense, right? What would you want, or what have you wanted when you've been in these experiences? And what could we do to make that simpler, more centralized, easier for you to own? Because you already are doing that. It's just way too hard right now.
And Nell, you talk a lot about sort of the data. Excuse me. You're doing a lot of data tracking. Your customers using your platform for data tracking. Then there's data at the provider side with the employee health records and stuff like, or the patient health records. There's the payer side of thing, and all of these data streams should be coming together to create a positive outcome. Is that happening? Is there missing links still?
It's a great question. Okay, there's like a radical answer, a less radical answer. I'm like trying to read the room. So the true answer is, in 2019, I was sitting somewhere close to here, where there was a Massachusetts digital health, what were we called? I don't remember. Working group put together by the governor, and I was like one of the 2 startup people, and there were a bunch of payer and provider organizations, and everybody talked about like, how do we get all this data together? How do we make sure that it's interoperable and give patients access? And the reality of that situation is that everybody was kind of like, oh yeah, we should do that, right? And there were a couple of us who had, admittedly less entrenched interests, saying, no, really, like there are ways to do that. It's actually very possible. And everyone's like, no, the technology is not there yet. It's pretty hard. Like we have a bit of a strange current incentive structure in terms of data ownership and who wants access. And everybody's trying to build, every organization. And I'm not just talking about, large payers and large providers, even the small ones, even the foundations, right? The not-for-profit foundations, everyone wants to own their little data mountain. The issue with that is we then make it very difficult to have a single source of truth. Our argument, again, admittedly serves our interests, but our argument is that this data should be centralized at the patient, right? Which I guess you could call decentralized, but it's centralized on a different point. It's instead of this hub and spoke model that we have right now, it's just spokes up to the hub, right? Because ultimately each person needs to have that data available to them whenever they want it. The providers, the insurers, the researchers only need it sometimes, right? And they can request it. There is a rule that everyone missed because it was passed in March of 2020. There were like 5 of us who were really excited about it. That is the ONC CMS regulation on basically decreasing data blocking, which means that technically every individual person now does need to be able to have digital access to their health data. And there is movement toward that, just like meaningful use. It's taking a long time to happen. But what we're saying here, right, is that like there really aren't any good reasons why people shouldn't have individual ownership and access to all of their health data. Our argument is that, ultimately you have to build a better source of truth on what they're experiencing at home anyway. So we're doing that. But then if you can aggregate the data from other sources and put it in one place, imagine having this, right? Imagine having everything, every symptom that you've experienced, all your treatments, how they've worked, and then pulling in your clinical records, pulling in your, insurance records as you need them, and then sharing these things out to researchers. Like that seems like a much more, rational way to manage this information as opposed to having it kind of in these little fiefdoms as it is right now.
I didn't mean to laugh, but the rational way. I love that idea. And, again, we're like you said, we're all patients here as well. And thinking about, how difficult is it for me to get my information? I would love the rational way. I'm all for it.
And Heather, you work directly with providers, correct?
Yes.
So what kind of outcomes was some of the, like, what feedback have the providers given you about the outcomes that they're seeing with their patients using your app?
Like I said, the whole thing started because my doctor said, I wish all my patients could be like you. Naively, I thought, okay, I will go do that. We're seeing amazing things. So at the moment, we're trying to do an efficacy study. Again, anyone in the area who would like a wonderful program to do an efficacy study, I'm here. But anecdotally, what we're hearing is lower readmits, lower complications, lower pain med usage. It's also interesting getting feedback from the users, the participants. We had one person go through it. I asked for feedback. She started by saying, I'm a nurse and I had fear in my body, like, oh my God, a nurse did this. I hope I didn't do anything wrong. And I said, so, okay, what do you think? And she said, yeah, everything's right on. Everything you're doing, right on. And I said, okay, do you want your money back? Did I waste your time? And she said, oh, God, no. And I said, but you knew everything in the program. She said, right, I knew everything. I wouldn't have done any of it without the framework. I wouldn't have done any of this without you gently knocking on my inbox every day saying, hi, remember, this is going on. This is important. So that's what we're hearing from people.
Interesting, like the shoe cobbler who has no shoes, right?
Exactly.
And you said something interesting that you lower reliance on pain meds? I mean, that's huge in
Yeah.
this kind of opioid.
Absolutely.
crisis.
Absolutely. Again, it's this ability to take control. When people have purpose and they are taking action, they are focused on things that they can be doing. They want this, they desire it, but it's hard. Again, back to what am I supposed to do? Where point me in the right direction. One of the best emails and saddest emails I got was from a participant saying, the day the program was over, I was so sad. I looked at my inbox. You weren't reminding me to log in. I want to know what to do. So yeah.
Interesting. A couple minutes. Any questions from the audience? No?
You talked about the dissonance between EHR data that's for billing and payer data that's related to their billing and what the clinicians use in the EHR. So I'm wondering how you're thinking about the patient consumer tech tool and research. So are we going to try to make every patient a citizen scientist, or are they motivated by their clinical journey, and then how do we make that actually helpful for the researchers?
Yeah, I mean, it's interesting. There are all kinds of people and patients, and it runs the gamut. In general, what we've done, so we've run, I think, 12 studies now in 5 different conditions. And the way that these studies work is that people are collecting information both for the research use and for their own use, but it's the same information, right? So, we recently ran a study in sickle cell disease that we'll be sharing some results of in the next few months. That study was enabling people with sickle cell disease to capture everything that they're experiencing, all of their symptoms, their use of therapies, their pain flares at home, and that's information that they're interested in for their own care, right? And we got a lot of very interesting, direct user feedback saying, yeah, this is something I'm bringing into my clinic. It validates my experience. It shows what I'm experiencing at home. It helps me to know when to call my doctor. But also that exact same information is useful to these researchers at this pharma company that we were working with, because they are interested in, like, what is the at-home experience of pain? Like, how often are people experiencing home pain crises? What's the full gamut of symptoms that they're experiencing, right? So because of that, you can have a single data set that has these different uses. And people can also, as you're saying, the citizen scientist, we have a program we call Canopy, which is individual users sending us requests for research that they're interested in doing. And then on a quarterly basis, we select one of the topics and we run analysis on our data set to try to answer a user research question, right? So like you can do all of these things with the same source of data.
We have one more time for one more.
Question for Heather. As far as payment for the services for the participant, how is it structured now and where do you see it going?
Again, when I think about all of the different constituents that I mentioned, the participant, the loved one, the doctor, all of them potentially are payers. Ultimately, like I said, also, I would love for physicians and surgeons, when they say the words, you have to have surgery for one of the next things after, and I'm great, and I'm going to do this really well. Here's a program that you should be doing in conjunction with that. I'd like to be at that top of the funnel and working with doctors. Right now, we are in a couple of different doctors groups. They pay a fee. We also go direct to consumer. Also, again, this started because it's necessary. It's part of the evolution and revolution of healthcare. We need support. We're in that moment. So if you are someone and you look at my website and you decide, yes, I need this, but I can't afford the $149, you name your price. If it's $0, that's fine. Everyone should be able to have this kind of support.
Excellent. Well, I think we're at time. Nell, Heather, thank you very much. Everyone will be all around this during the breaks and stuff. So I hope to chat then.
Thank you so much.
Thank you.